Good morning, guys and gals. Let's talk about the most dysfunctional healthcare system we have, folks. Yes, we do have a dysfunctional healthcare system. If you don't believe it, I'll prove it to you. Okay? When I stayed in the hospital for an angioplasty for 23 hours, 10 days later, I received a bill for $227,000. And the funny part is, out of $227,000, the Medicare, this is our Medicare, they paid the hospital $35,000. Even that is too much. Don't you think so, guys? Even $35,000. The reason hospitals bill higher, so they can collect the copays, whatever the Medicare approves. The 20% they can rip off your supplemental. That's why people are broke. Yes, people are broke, man. They can't afford it. Can you imagine for 23-hour stay, hospital bill of $227,000? That's what pissed me off, man. It is not right. It is just not right. I think average folks can't even get health insurance. The reason being, the bills like this keep raising your health insurance premium. And if somebody doesn't have insurance, they're broke. If they get a bill like this, they're literally broke. So that is number one. Number two, folks, I want to be honest with you. I've been in the healthcare for almost 40 years now. I know what I'm saying, okay? Don't take me wrong. I love to take care of the indigent, and I would love to take care of the people who are impaired, physically, economically impaired. This is what the forpay.org, which is a foremost organization. I work for I'm the volunteer for the foremost organization. This is my passion, a lifetime passion. To healthcare has to be addressed. How do we solve this healthcare mess? Coming back to the indigent and impaired population. I have taken care of 30, 40 Medi-Cal patients, done some procedures, scopes, whatever you may call it, and my biller billed the Medi-Cal. All right? This is not funny, folks. This is not funny. Medi-Cal, so-called state-sponsored Medi-Cal, they had the audacity to send me a check for 1 cent. 1 cent, folks. That's another thing I cannot forget. I wish I had it framed and put it aside somewhere. I didn't do that. Obviously, it was done about. There are several instances like this from my healthcare practice. And number three, this billing system, man. Billing system is a mess. Do you believe there are 9,000 billing companies all over the country, all over the world, ripping off our healthcare system? All these numbers, so-called numbers, are made up. They're not consumer demands. They're not based on the consumer demands. They're all made up. They're cooked up. That's what I want to see a change. Healthcare has to be. Why is it? I understand everybody, all these so-called established insurers, they want to have a status quo. That's not right. We need to give power back to the people, man. We have to have the power back to the people. If you do like what I'm saying, you think there's a value in my talk, I'm not bullshitting. This is the reality, folks. I'll keep addressing this issue of this healthcare debacle till the day I die. This is my goal. I'll continue to talk about it. I should give credit to Ron Bachman, an actuarial who lives in Texas. He has written a book, Unlocking the Secrets of Healthcare. Please go to forpay.org landing page. You will be able to access it. I should give a credit to Ron Bachman. He's been an actuarial in healthcare for 50 years. He's the one who introduced the Medicare supplemental, folks. He's excellent. I give him a credit for that. Credit goes to him, not me. Basically, I'm a messenger, folks. I'll continue to talk about it. If you do like this channel, subscribe, share, make some comments. This is my early morning walk on my Kangoo shoes in Spring Valley Park, California. Thank you, guys. I love you. I'll always love you. Follow me and do subscribe. We, you and me, and we all together have to solve this dysfunctional healthcare. Thank you. We'll see you next episode.